we'll just wait for a few people to start joining, and then I will get started dead on 8:15. Hello, Mohammed. Just wait a few more moments and we'll get started soon. We'll get started, and if others want to join in later on, then they can. So today's live is going to be about menopause. I previously done one on the menstrual cycle, so quite a few things I will say refer back to that one, just because I've gone into quite a bit of detail about like estrogen and a few other things already. So some of them are closely linked. So if I do say refer back, then please go and watch the live on the menstrual cycle. So first of all, what we'll do, I'll kind of explain what kind of sections I'm going to go through, and then we'll get started. So what I'm going to start with is obviously what menopause is, then go through a few symptoms, then I'll say how exercise can help, and then what exercise we would advise for you to do. So obviously with each one of those sections we'll say blah 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 blah, explain it, a few references, and then I will open to any questions at the end if anyone has any. So what we'll do, we'll start with what is menopause. So menopause happens to every female in their later stages of life. Normally it happens between the age of 45 to 55 years of age, and what menopause is basically when a female's periods will stop and they can no longer naturally become pregnant. You still can use other forms like IVF or surrogacy, etc., or obviously adoption, but unfortunately a female will no longer be able to naturally conceive. In the UK, generally the average age for women to start having menopause is 51 years of age. So that's generally when they'll start to have some symptoms, and then their periods will naturally start to stop. Generally what happens with that and why menopause starts to happen is because levels of estrogen start to decline, and obviously, as spoken for in the menstrual cycle one, estrogen is one of the main hormones that you have during your menstrual cycle and which cause you to have your periods. So normally in 1 in 100 women will start to have menopause before they're 40, unfortunately. So this is known as premature menopause, or premature ovarian insufficiency. So generally if this does start to occur, it's normally said to go see a GP just to kind of get some extra help and some extra advice. So symptoms, there are quite a few, and some that are known to everyone, as women say, oh my god, I'm having a really hot flush and feeling quite sweaty. So that's generally one of the main symptoms that is an effect of menopause. So women will generally have a lot of night sweats, they'll have random hot flushes. So a lot of women will be like, oh, I feel very like anxious. Some will have a few heart palpitations. It's just because you've got high levels of hormones again, and it's just kind of bringing everything to the surface. It will generally only happen for about several minutes. If they are lasting a little bit longer, then again we'd say go talk to a GP, just because they can give you some medication or some actual help, and also some leaflets about how you can kind of change and monitor the symptoms. Also, you'll generally start to have irregular periods. So for some women, when they start menopause, their periods can just completely stop. But generally it does take around 7 years for your periods to slowly stop. And then obviously you won't be able to conceive after that point. Some women can have very irregular ones, so they can have one maybe every 6 months. Some can have them a lot more frequently. And then generally after they happen quite frequently, then they'll generally stop quite quicker. It can also cause joint and muscle pain and stiffness as well. So that's one that we'd want to kind of look out and kind of deal with and help you with. Obviously being sports therapists and physios, we want to always make sure that you've got great range, you've got great flexibility, you're not in as much pain. So that's something that we'll be more able to help you with. There's also like a few exercises you can do. Going for daily walks is really highly recommended. It's really, really good to kind of help with reducing joint pain and muscle stiffness as well. Generally another symptom is insomnia. So this is generally when women have, and general people will have trouble sleeping. So it will generally mean you find it hard to sleep. Normally it is because of night sweats, so obviously because you're quite like warm and hot, it's quite difficult to sleep, especially in climates like now. It's quite hot today and the next few days, so women who have got menopause will be suffering quite a lot in the next few days, unfortunately, because it's already warmer, and then if they have that as a symptom, it will be slightly increased. Other problems can be problems with your urine and other bowel movements. So generally what happens is you can be more generally you can be more exposed and more likely to have UTIs, so urinary tract infection. You can also have leak in urine, and you might also need to go to the toilet a little bit more frequently. Unfortunately, that is probably one of the worst symptoms you could kind of have, as obviously no one wants to be needing to go to the toilet more than what they need to. Other ones is it can cause issues with your libido and kind of other problems down there. So with some ladies, they can become quite dry. They might also become very, very sensitive, because what happens is the linings will start to change, and with that women can sometimes have a bit more pain. They might feel a bit more anxious, might feel a bit more nervous. Some can also have like itching or other forms of irritation as well. So it's always something to look out for, and some issues like that we would highly advise for you to also go to a GP and talk about, as obviously sometimes they can get worse, sometimes they can get easier. So with those ones, it's always good to make sure that you are tracking your symptoms and kind of seeing, okay, is this normal, is this not normal, is this happening too much, is it not happening at all? Then that's fine. It's just you want to make sure that you are managing the symptoms and seeing what you have and what you haven't got, and making sure they are in the norm. So in terms of how exercise can help you whilst you are experiencing menopause, it has loads of benefits. Exercise always has, regardless of kind of what issue you kind of have. Exercise is normally quite a good thing for you. So obviously one of the main symptoms as well that you could have is a lot of weight gain. So in terms of exercise, exercise will help prevent weight gain basically. Obviously when women tend to get older, they start to lose muscle mass more, and especially for women, we will start to gain a bit more weight around our abdominal area. So obviously the more exercise you kind of do, the more regular it is, the better you will be, and the more weight you hopefully won't gain. So generally we'd say do a bit more walking, a little bit more aerobic exercise. You can do high intensity as well, but it kind of just depends on how much joint pain or muscle pain that you are experiencing as well, because you don't want to do too much that you're then going to overload your body, and then you're going to leave yourself sustainable to having an injury. So it's always make sure that you are feeling okay, don't overdo it. Just try to do maybe 150 minutes a week, or about 10 to 20 minutes a day of just going for a nice gentle walk, going for a cycle, swimming, or just going playing some recreational sports, so maybe a little bit of tennis, a bit of badminton, all those kind of sports, or anything that you enjoy. Walking, netball is quite a fun sport as well. Same thing with football. There's loads of different things out there, so it's always good to kind of see what there is and then join into it. So you don't have to stop exercise at all. It's really, really good for you. It also has other benefits in terms of like strengthening your bones, because obviously during menopause you tend to lose bone strength and bone density, so then you're more susceptible to fractures and osteoporosis. So obviously the more exercise you kind of do, the stronger you will get. So it's really, really important that you do keep exercising whilst you are experiencing menopause. Sorry, my computer died earlier. It can also help to reduce the risks of other diseases. So obviously the older you tend to get, the more exposure you have to certain diseases. So in terms of heart disease, type 2 diabetes, you do want to help reduce those symptoms. So obviously exercise is known to help reduce that, because the more healthy you are, the more healthy your body is, the better everything keeps working for as long as it can. And then obviously exercise is known to increase and boost your mood. So for me personally, I know whenever I go to the gym in the morning, or when I go for exercise, just go for a walk or something, I feel greater, I feel happier. Sometimes you will feel like, obviously, a little bit, if you've done a really good exercise or a really good gym workout, you'll feel a little bit tired, but generally your mood itself will be better, because obviously endorphins are being released, and endorphins make you happier and boost your moods. So in terms of the exercise that we would recommend for you to do, we'd always say do aerobic activity. So obviously jogging, walking, cycling, swimming, water aerobics, literally from as little as what I said earlier, 10 minutes a day can make all the difference, especially if you're trying to lose a little bit of weight. It just helps. The more mobile you are, the better it is. So those obviously now who, with lockdown, everyone's been kind of sitting down inside, we'd highly recommend that you just take a 5-10 minute walk or a 15-minute break, and just trying to get out, relax, and help boost your energy and not be so stiff, because obviously the more dormant you are, the more sustainable you are to having a lack of energy and other issues. Also, we'd recommend that you do some strength training. Obviously, as I stated before, you do generally tend to lose muscle mass, so it's very, very important that the muscle and the definition that you have already, you try to maintain as much as you can. We're not saying go and lift 50 kilograms, we're not saying go to the gym and go absolutely mad. It's all about having a good balance. So maybe just using some of the resistance machines, using as small as little 2 kg dumbbells, kettlebells, anything like that, just to kind of increase your strength. So it's not just saying, okay, go do leg press, go do squats, RDLs, all that kind of stuff. It's more specific to what you want to do. So if you want to gain upper body strength, then use dumbbells, do some like bicep curls, even like carrying shopping bags sometimes, if they're quite heavy, they still count as some sort of resistance and some sort of strength training. So you don't necessarily have to be at a gym in order to do some strengthening exercises. There are many things you can use at home. You can use rice in a bottle, or like I said, shopping bags. Mine, especially when I go shopping for a big day out, then I generally come home with quite a lot of shopping bags. They're quite heavy, so then you're still kind of using your body and still working. And obviously with increasing your strength as well, you'll generally be quite happier. You won't feel as sore, your pain should decrease because your muscles are stronger. Again, your bones are being supported as well, so then your ligaments and tendons and stuff should all stay nice and strong. And then we'd also say try to look at increasing your stretching, as flexibility is very, very important for your muscles. So with that, we'd kind of say set aside maybe 10 to 15 minutes a day, just do some stretches. They can just be very general ones, so just as simple as doing some hamstring ones, upper body ones, especially upper fibre of the traps, A lot of people are getting a lot of neck tightness, so it's very important to just kind of relax and reduce the tightness in your body, so then you don't feel as stiff, and then you can kind of sleep easier and get on with all your exercises easier in day-to-day tasks and jobs. We'd also highly recommend increasing stability and balance as well, as generally the older you do get, generally you start to lose balance and stability as well. So it's really important that you kind of focus on increasing that so you prevent falls. So you can start off with some very, very simple exercises that we have already put onto our Instagram, which I've put under ankle proprioception. So you can do the wide balance test, or you can do the standing and reach, or you can do very, very simple ones of just standing on one leg, or standing on both legs, closing your eyes, standing on one leg, closing your eyes. All those kind of things are working and still doing balance and stability. It's not saying you have to do like really, really high exercises. You don't have to overcompensate. It's just things that you feel comfortable doing and like easy ways to kind of make it better. So the simplest thing is just standing on one leg, doing that every day for 1 or 2 repetitions, repeating it 3 to 4 times can be very, very effective as well. But the easiest way to kind of do exercise is just going for a walk with your friends, go to a park, go to the coffee, go shopping as well. I know if I go shopping I can spend probably about 2-3 hours walking around in shops, so that can still be used as a form of exercise. It doesn't have to be anything too strenuous at all. So generally there are quite a few things that I've mentioned today, obviously with what menopause is, how it can affect you, what symptoms to kind of look out for, and then that we would always recommend you to continue doing exercises. So if anyone has any questions they would like to ask, please ask them now. If not, you can drop us a message directly, or you can send us one afterwards, and we'll be more than happy to answer any questions. I've not gone in much detail about the hormones themselves, as generally the hormones will be the same as the ones that you experience with the menstrual cycle. So as I said before, please refer back to that one and learn a bit more about how those hormones work. So if anyone's got any questions, please ask away. Okay, so as I can see, unfortunately there's no questions today, so that's fine. So like I said, anyone who is watching this on a recap or as a highlight, please drop us any messages and let us know if you have any other questions. I hope you have enjoyed the live today. Hopefully we'll speak to you again soon, and we'll let you know what the next live is within the next few days. Brilliant. Enjoy the rest of your evening, guys.